Good day, dear colleagues. This is Ahmed El-Damaty, Associate Professor of Cardiology, Cairo University. I hope we all have a healthier and happier 2021. My topic today is about the 2020 wrap-up of arrhythmology and electrophysiology. And I will start off by talking about the field of atrial fibrillation ablation. And the first study that I want to highlight is the Pulsed AF study. The Pulsed AF study is a study about the use of a new modality of energy, that is the pulsed field ablation, which is basically an energy sources that utilize a biphasic electric current in achieving electroporation of the cell membrane and thus leading to cell death. The investigators of this study that was done through centers in Canada and the US reported the safety and the efficacy of the pulsed field ablation in the electric isolation of the pulmonary veins in patients with paroxysmal atrial fibrillation. The investigators had 14 patients. They reported a success rate of 100% isolating all the veins, and that was of course an acute success rate. And they reported no side effects that is related to the ablation energy source. They only had one patient who had a groin hematoma, which obviously was not related to this energy source. And the investigators are planning to present the data of the 1-year follow-up in 2021. On a different vibe, this year witnessed the East AF Net4 study, which is a study that randomized patients about 40 rhythm control therapy in patients with atrial fibrillation and cardiovascular morbidity. So one arm was early rhythm control, be it drugs or ablation, and the other arm was the usual care, which was rate control in most patients. The primary outcome was the cardiovascular death, stroke, or hospitalization with heart failure or acute coronary syndrome. And the primary endpoint was significantly less in the early rhythm control group, which is a study that may pave the road to a change of the dogma that rhythm control does not offer much over rate control, at least in some patient groups, and at least when ablation is used in those group of patients. This year also witnessed the establishment of the CCCC to ABC concept, which was published in the European Guidelines for Atrial Fibrillation. So this started off with confirming the atrial fibrillation with a 12-lead electrocardiogram or a Holter monitor, provided that the AF pattern remains for more than 30 seconds. It went through the concept of characterizing the atrial fibrillation, the 4S concept, that goes through the stroke risk assessment, the severity of the symptoms, the severity of the AF burden, and the substrate severity. And then it finalized by the treatment of atrial fibrillation, which is the ABC pathway, A standing for anticoagulation, B standing for bitter symptom control, and C standing for control of the comorbidities and the cardiovascular risk factors. Shifting gears to another arena, which is the ventricular tachycardia, the ENCORE VT investigators reported their longer-term outcome. In the ENCORE VT study, the investigators looked at the use of stereotactic ablation therapy, the same therapy being used for many years in the treatment of cancer, and its efficacy and safety in patients with refractory ventricular tachycardia who failed medical treatment and either failed an ablation procedure or are not suitable for an ablation procedure. So the investigators reported efficacy with marked reduction in the number of ventricular tachycardias per patient, And that happened during the first 6 months and persisted till a follow-up duration that ranged from 18 to 24 months. In terms of safety, the investigators reported pericarditis that occurred early on during the course of the treatment and pericardial effusions that occurred a bit late, together with only one gastropericardial fistula in one patient that was thought to be related to the radioablative therapy because of its occurrence in an area that is related to the inferior surface of the left ventricle where the radioablation was performed. However, in terms of survival, it was reasonable when this group of sick patients were looked at, where 90% of the patients survived till 6 months, and about half of the patients survived for 2 years. Another area is the area of SVT, and we are here going to cover the Node 301 study that investigated the use of etripamil in the termination of paroxysmal supraventricular tachycardia out of hospital. The investigators of this group looked at the superiority of etripamil over placebo in terminating PSVT in the outpatient setting. Unfortunately, the drug failed to satisfy the primary endpoint of the study, which was cardioversion of the PSVT over 5 hour duration. Um, so this perhaps would point to the use of a different dose of the drug, or perhaps the use of a different modality of therapy rather than this particular drug. In terms of device therapy, two important studies I want to highlight in this presentation. The first is the Praetorian study, which targeted the non-inferiority of subcutaneous ICDs in terms of the safety endpoint as compared to transvenous pacing. So the investigators randomized patients into one-to-one fashion to either a subcutaneous ICD or a transvenous ICD. The primary composite endpoint was that of a device-related complication or inappropriate shocks. As you can see here, device-related complication numerically was higher, of course, in patients who had a transvenous ICD, while inappropriate shocks were higher in patients who had a subcutaneous ICD. But when the composite endpoint was looked at collectively, there was no difference in the primary endpoint in both groups, pointing to the non-inferiority of subcutaneous ICD versus transvenous ICD when the safety endpoint was looked at. Finally, left bundle branch block pacing was looked at in terms of safety and efficacy in patients who are CRT candidates. If we look here at this graph, we look at patients with left bundle versus those with non-left bundle, and there was significant reduction in both patient groups in terms of the QRS duration, the NYHA class, and the left ventricular end diastolic dimension. There was an improvement of the left ventricular ejection fraction as well in both groups. As expected, the degree of improvement was more pronounced in those patients who had left bundle branch block. The response rate for this modality of therapy was comparable to the CRT in terms of the clinical response, was perhaps higher than most of the studies for the echocardiographic response, and impressively, the super response rate occurred in 30% of cases, pointing to a safe and an effective modality of therapy that could pave the road to use this kind of therapy as compared to the CRT. So my take-home messages would be that pulsed field ablation is the first non-thermal inhuman energy source that showed safety and efficacy, particularly in patients with paroxysmal atrial fibrillation. Rhythm control strategy is more effective than the usual care, was in most cases a rate controlled strategy in patients with recent atrial fibrillation and cardiovascular morbidity. Radiotherapy is a safe and effective modality for the treatment of scar related ventricular tachycardia in patients who failed medical treatment and catheter ablation. Etripamil 70 milligrams failed to reach the primary endpoint of terminating SVT within 5-hour limit when used in the outpatient setting compared to placebo. SICD is non-inferior to transvenous pacing in terms of the primary endpoint of device-related complications and inappropriate shocks. Left bundle branch pacing is safe and effective in patients who have pacing indication or those eligible to CRT. Thank you very much.